Welcome to Sound Health on Lagos Television. I am Ola Sumbo Mudupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues from around the world. This week, we are looking at cerebral palsy, another aspect to this neurological condition. Adults living with cerebral palsy, we are looking at how they are going to navigate this path, especially when their caregivers are being overwhelmed. An expert is on standby and you get to meet him after this break. The program is still Sound Health on Lagos Television. Join us this evening to look at living with cerebral palsy as an adult is Air Vice Marshal Femi Gbadebo, founder Benola Cerebral Palsy Initiative and father to a non-verbal and fully dependent 29-year-old male living with cerebral palsy. Good evening, Air Vice Marshal Femi Gbadebo, and thanks for joining us.
Good evening, and thank you for having me.
All right, Air Vice Marshal Femi Gbadebo is also an OFR, the Officer of the Federal Republic of Nigeria. And thank you so much for joining us, finding time to join us on the show this week.
Thank you. Thank you for having me.
Okay, from my introduction, you have been providing care, not just to an outsider, but to a relative, to a son for the past 29 years. Tell us, how have you been able to navigate this path before we look at cerebral palsy itself?
It has been a very challenging situation. For somebody on the outside, it's almost like an impossible thing to deal with. But when you start with a young child, a baby, an infant, and then he starts to grow, and initially you have expectations that things will get better. So you go for all kinds of medical interventions, you engage a lot of therapy, a lot of medication, and by the time the child starts becoming a teenager, you come to the realization, as experts must have told you even much earlier in the journey, that it's a condition that has no cure. It's not infectious, it's not contagious, but it manifests differently with each person. So you can't be looking at somebody else's situation and say, oh, I wish my son could do this, or I hope my son could be able to do this in a couple of years. You have to deal with the individual situation as it is. And you, hopefully you get to understand that as a parent, as a caregiver, your responsibility is to provide the best condition possible under your financial situation. And honestly, once you do that, things will fall into place. Of course, we have been fortunate to be able to engage caregivers, nurses, male help, and so on along the line, but there have been periods when they walk out of you, and it's just me, my wife, and my sons, and so on. So it's been a tough journey, and I'll tell you that the cost is unbelievable, because especially now, the cost of diapers, the cost of medications, they've gone through the roof. And you just have to continue to do the best you can.
Okay, before we go to the more detailed part, now let us know what cerebral palsy is. I'm sure viewers at home are wondering what exactly is this condition the resource person is talking about. What exactly is cerebral palsy?
It's a condition that has to do with the brain and also the muscles. At some stage, either during the pregnancy or during the process of birth, or within the first 4 and maximum 5 years of child's birth, there are accidents. There are situations like, meningitis or a flu that is mismanaged that affects the brain's development. And with cerebral palsy, it also affects the muscles. So the child's ability to control the muscles is compromised. One of the most vital muscles in our body, which most of us don't realize, is our tongue, which we use to talk, to do other things. And because saliva comes into your mouth to keep your mouth moist, if you are not able to control your tongue, you will begin to drool. That is, you pour saliva at will. And then you will also have problems with swallowing. Cerebral palsy affects the child in various ways. I don't want to go into technical terms now, just keep it simple. It can affect the upper part of the body from the waist upwards. It can affect the side, maybe the right side or the left side, and it can affect from the down. And it can also have multiple mixture of conditions. But wherever affects the muscle, it's almost like the child has a stroke. So this side tends to pull on the weaker side. And it does affect the development of that side. So you'll find a child under 1 or 2 years old with cerebral palsy will always clench one fist. That's one of the first signs. But other than that, it's a progressive situation. It doesn't get worse, but because the child develops, you could have a child who started to crawl and then loses the ability to crawl, or even tries to walk and then loses the ability to walk. And then, of course, as they get older, more and more complications come. You talked about neurodevelopmental disabilities, a whole bunch of them. It could be autism, it could be Down syndrome, it could be attention deficit disorder, etc., etc. Now, the thing with cerebral palsy is that some children with cerebral palsy also show signs of autism, they show signs of attention deficit disorder. And that's why if you've done like my son, end up non-verbal, meaning that they cannot speak. When we say fully dependent, it means that even at 29, my son has to be carried from the bed to a chair and so on, and he has a diaper because he cannot predict when he's going to move his bowels or pass urine and so on. So it involves a lot of effort on the part of the caregiver, parent or nurse or whatever, to keep the child clean and to keep the home clean and comfortable for visitors who may wish to come and visit the child or the family.
Okay. Initially, when I reached out to you about this topic, I was actually thinking getting cerebral palsy as an adult, not knowing living through cerebral palsy. From your narration now, it has to also, we also need to know about the early symptoms, the signs. Parents need to watch out for these signs and symptoms early enough before you can say this person is living with cerebral palsy. So from your narration, I could also depict that it is not about finance, but showing love, adequate attention, rapt attention to the person living with the condition. Tell us, how have you been able to navigate this path? Because it is not just about caring for your son now. You also, because you have been doing a lot for over a decade. Tell us. I know parents can be overwhelmed with all of these conditions, not just cerebral palsy. If you're to engage a young parent living with a child, not to talk of adults now, how do you want this parent to navigate this path?
Where they have a consultative surgeon. who will help guide the child's condition. You see, child is born. It used to be that for the first 2-3 years, parents are not sure what's happening. But we have reached a stage, both amongst parents and healthcare practitioners, have resulted in a situation where children are diagnosed even before they are getting older. But that is important. So even though I say we have diagnosis at 1 year or so, there are still parents who have children what we call mild cases of cerebral palsy, who are able to start around, read, and even go into school. I've encountered it who never realized they had cerebral palsy until one of them fell sick during the NYC, and that's when it was discovered that he had cerebral palsy. The reason that I'm saying is that if you go to some homes or if you see bad cases of cerebral palsy, the tendency is to think that, oh, my son is not that bad or my daughter is not that bad, so it can't be the same situation. Yes, they are developing slowly. Yes, with effort, with physiotherapy, they could get better. But the truth is that it is something that the child gets before the child is 5 years old. After 5 years, there could be accidents that could result in some form of grave. In that case, it is not cerebral palsy. It could be maybe spinal cord injury or whatever the case may be, but it's totally different. And one of the telltale signs is that if you see a child like that who is 10 years old or so that has a steady neck control, then it is not cerebral palsy. It means that the child had developed neck control long before they had some accident that resulted in this deterioration of their body. So for the parents, like I said, the advice is to go to specialists. It's not just something they look at. They will do ECG, they will do because they want to check the functions first. And that's when this is ready for me. But when the detection is made, no doctor can tell you how it's going to be. It's something that is going to live, it will hope, it will not be too bad. And that's how we get adults now who have gone to university. Some of them have their master's degree, a few of them are married. I know one or two of them who are even driving. Okay, so it's but it's possible if the parents who are bold enough to get the right diagnosis early, to get therapy like physio and maybe occupational therapy and speech therapy, and to continuously provide medication that will reduce the muscle and other frictions, even seizure. I think that must be, because each time a child has a seizure, it's like winding the clock of development. They lose some aspect of their development. So effort has to be made also to sort out the issue of the seizure with the tongue. Speech therapy, which comes in various forms, will help with drooling, it will help with eating, and at the end of these are all the things that make it easier for that special child to fit into normal school environment.
All right, living as an adult with cerebral palsy, are there health conditions they develop along the line that they manage alongside cerebral palsy?
Oh yes. Unfortunately, I have run into a lot of adults with cerebral palsy who, because, like I said, their situations can be considered as mild. They're able to speak reasonably well. They're able to go to school, even to university. Some of them are able to like hobble around without crutches and stuff like that. But you will see that there's deformation in the legs, particularly at the knee and at the ankle, but they move around. And I remember there's one particular child that the mother brought him, we had to bring him to me. And after a therapist suggested that he use a walking stick or something. You see, persons with disabilities, especially the adults, they're very proud. And they want to be treated as normal as possible. And so you'll find that they don't want to use crutches, they don't want to use wheelchairs until unfortunately it becomes too late. The reason was, and if it becomes too late, maybe at 40, 45, because the things that happens to adults, cerebral palsy, is that they age faster. When I say they age faster, they begin to experience symptoms of aging like arthritis and a few other things. So you find knee pain, so becomes very difficult to manage. If at some early stage if you use walkers or assisted devices, or they started to use a wheelchair. Using a wheelchair doesn't necessarily mean that you can walk. But why walk at 500 meters? Somebody can push you with a wheelchair. Then you get to the steps. You climb the steps. And then you use the wheelchair all the way. Then you are saving yourself some unnecessary trauma that will come much earlier. Then in terms of medication, like I said, painkillers, these are things, all things are prescribed by specialists. So it's not about just going to the pharmacist and say, oh, I'm having pain, I'm having pain, and so on, because there are different kinds of painkillers that address different issues in the body. And these are issues also what you call muscle relaxants and a whole bunch of stuff, which have a road enforcement. You can imagine when somebody has maybe lived for like 30 years without medication, it's difficult to convince them that you have to take even vitamin supplements are also very important for them to take. So these are all the things that are there. And I think the most important one is accepting that you cannot do certain things. I remember some years ago when we were still organizing walks, there was one of this young lady who was starting in her 30s. She, instead of walking with us, of course, she kept us back because she had difficulty keeping up with the pace. At the end of the 3.5 kilometer walk, and I asked her, how did you? And she said, this is the first time I ever did something like this. And I panicked because I should have asked, okay? But you see, people just show up at the event and they want to get it. A retired military officer, I'll tell you, we have had indication, you know that the military does 10-kilometer walks and runs every year to check for fitness and all that. And unfortunately, we have had situations where at the end of the 10-kilometer run or walk, somebody will collapse. And from there, take them to the hospital and they pass on. The reason is that, many people decide to start an exercise or go to the gym without first checking on their medical condition. And so you overstretch yourself, and that's where these problems come. Thank you.
All right, your final words as we wrap up now in 30 seconds, sir.
Aging is a reality that nobody can learn. But if you have cerebral palsy or any of the disease, the chances are that the symptoms of aging will come on you much earlier than the average person. And so do your medical checks regularly as soon as you feel something.
Thank you so much, Air Vice Marshal Femi Gbadebo, on living with cerebral palsy in adulthood. Thank you so much once again. I believe somebody out there has been motivated with your words of wisdom and your expertise.
Thank you for having me.
Right, Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television, and we have been speaking with Air Vice Marshal Femi Gbadebo, OFR, on living with cerebral palsy in adulthood. He has shared so many words of wisdom, how people can navigate the path, because he has a wealth of experience nursing a son, a child with cerebral palsy in the last 29 years. Remember, you need to report symptoms early enough. Make sure you take your medication. Do not self-medicate. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. The Sound Health is a sound mind. Make healthy living your choice.
Looking for a program that will